Yo guys, welcome to our video. When we talk about adult bedwetting or what we call nocturnal enuresis, it is a common thing, but which has various underlying causes. I don't know if you have ever heard of adult bedwetting or when we have adults wetting their beds because it's unexpected of most of adults to experience that one, and normally it is not a very comfortable scenario, but it is what it is, guys. The channel is Nazvin. Kindly, if you have not subscribed, I want to encourage you to subscribe and also share it widely. Give nice comments below. And if you have not visited our channel, it is really growing. We're in our journey to 10,000 subscribers. So while it is less common in adults than in children, it can still occur and may be indicative of underlying issues. That's what when we talk about adult bedwetting, and it can be medical or psychological condition. So, but I'm going to state some of the causes of this adult bedwetting. So, number one is about bladder problems. When one has issues with the bladder, such as overactive bladder. Guys, I've done a video on overactive bladder. Kindly, if you have not watched it, I'll attach it here. You get to watch it on the overactive bladder or OAB. So, also another cause can be urinary retention or incompetent emptying of the bladder can also contribute to adult bedwetting. Bladder problems may result from neurological conditions, bladder muscle dysfunction, or the obstructions of the urinary tract. Number two cause is about urinary tract infections or UTIs. Infection of the urinary tract, including the bladder or the urethra, can be the cause of this and can irritate the bladder and lead to increased urgency and frequency of the urination, potentially resulting in bedwetting. Number three, most common cause is diabetes. Uncontrolled diabetes, especially type 2 diabetes, and also type 1, can lead to a high level of glucose in the urine, what we call glycosuria, and increase the urine production, or what we call polyuria in medical terms, which may contribute to bedwetting. So the diabetes, especially they say according to the research, type 1 can really can contribute to high bedwetting because of high level of glucose in the urine. Neurological disorders. When we talk about neurological disorders, we're talking about the disorders which affect the nervous system, especially when we talk about what we call Parkinson's disease, spinal cord injury, stroke, patients who have stroke, and also what we call multiple sclerosis can disrupt the bladder function and control, leading to adult bedwetting. Number five is about sleep disorders. There are people who have neurological conditions, especially the sleep disorders such as obstructive sleep apnea or what you call SOA or OCA. So, or restless leg syndrome may disrupt your sleep patterns and increase the risk of bedwetting in the adults. Also, guys, number six is about hormonal imbalance. When a patient experiences hormonal imbalance, especially what we call antidiuretic hormone or cortisol, can affect the urinary production and also the function, potentially contributing to bedwetting. Number seven is about medications. There are medications like diuretics. These are the drugs which make you produce a lot of urine in the body or a lot of water. Sedatives, antipsychotics, antidepressants, or medication of high blood pressure may affect the bladder control and increase the risk of bedwetting. So patients who are in heart medications or are on hypertensive drugs or have high blood pressure and their drugs are on drugs. So these drugs sometimes may affect how the bladder works and also they may be predisposed to bedwetting in adults. Psychological factors, especially stress, anxiety, depression, or other psychological factors, can influence the bladder function and contribute to bedwetting in adults. Also, emotional stress or trauma may also affect the nocturnal enuresis or adult with bedwetting. Also, genetics, family history of genetic predisposition may play a role. That's a difficult word. Predisposition may play a role in adult bedwetting, guys, suggesting a potential hereditary components. Guys, those are the 10 most likely causes of these nocturnal enuresis or adult bedwetting. So it is very essential for adults experiencing bedwetting to consult with the healthcare provider to do the proper evaluation and also and diagnosis to determine the main cause of the main cause and also determine the appropriate management. So the treatment may involve medication and also adjusting the medication, especially those patients with who have chronic illnesses and are on medication. We have what you call behavioral therapies, which can be introduced, lifestyle changes, or other interventions which are tailored to an individual depending on the cause. So, what are the mainstream treatment for adult bedwetting? Treatment of adult bedwetting or nocturnal enuresis depends on underlying cause and it may involve combination of the approaches. So I'm going to give some common treatment options which are available. Number one option is about medical evaluation. So, because coming up with the proper diagnosis for this kind of a patient or an individual is very important why this one is coming up. So, thorough medical examination for a bedwetting patient or a client to undergo is very important to identify any medical conditions or contributing factors. This may involve a physical examination, urinary tests, blood tests, imaging studies, and possibly urodynamic testing to assess the bladder function. So that medical evaluation is a very key component, number one, which is introduced to that particular individual. Treatment of underlying conditions. After the thorough medical examination, if underlying medical condition is identified, such as urinary tract infection, diabetes, neurological disorders, or sleep disorders, so the patient is introduced to what can really counter that problem. So if it is medications, they are adjusted accordingly. If it is a neurological condition, it's treated accordingly on the specific target at managing the specific condition. Bladder training is another option, number three, which is introduced to that kind of a patient. Bladder training techniques can help improve bladder control and reduce the episodes of bedwetting. This may involve scheduling voiding, gradually increasing the time between bathroom visits, and using relaxation techniques to delay, to delay the urination. So the special exercises, which one is introduced to, so, which really train the bladder and also the pelvic muscle exercises to really help such kind of a patient. That includes delaying the frequency of going to the bathroom to empty the bladder. Medication, in some cases, medication may be prescribed to adults who is bedwetting. This may include anticholinergic drugs, medication to reduce bladder contraction, like desmopressin or DDAVP to decrease urine production at night. So there are special drugs. This is called desmopressin or DDAVP to decrease the production of urine, especially at night, or tricyclic antidepressants to relax the bladder muscles and also increase the bladder capacity. Behavioral changes or behavioral therapies, like what you call cognitive behavior therapy, is introduced at some point, or of biofeedback may be helpful in managing the adult bedwetting, particularly the psychological factors when they are the contributing factor to the condition. These approaches help address stress, anxiety or emotional factors that may be influencing the functioning of the bladder. Also, number six is about lifestyle modification. Making lifestyle changes can help improve bladder control and reduce the frequency of bedwetting episodes. This may include limiting fluid intake before bedtime, avoiding if you are addicted or you are in overuse of caffeine and alcohol, and also maintaining healthy weight and practicing sleep hygiene as appropriate. So lifestyle modifications like doing away with caffeine and alcohol or reducing in it, and also maintaining healthy weight. That's where now exercise comes in, and also practice of good sleep hygiene is introduced at that particular point. And also bedding protection is one of the approaches on the management of the condition. Using waterproof bedding, mattress covers or absorbent pads can protect bedding and minimize the inconvenience of bedwetting episodes. I remember even in high school, we used to have a special polythene for those guys who used to have that problem of bedwetting. And also, I see it in the hospital. We use a Macintosh to cover those beds for those patients, especially with the stroke and other issues, so that you don't make that bed very uncomfortable for them. So you have to change part of it so that you leave the patients or the individual as appropriate. Even Macintosh can be introduced at home if we are doing the home-based care for that kind of a patient. The special Macintosh is used so that you make the patient as much as possible comfortable to avoid the patient developing bed sores. Not actually even the patient, also those people with that condition of adult bedwetting can be make. You want to make them as comfortable as possible. Supportive care, when it is emotional support and encouragement from healthcare provider, family members, especially when you have that kind of a person in your family. I remember the use of those waterproof beddings, mattresses, covers, absorbent pads, and also they help to protect the bedding and at the same time minimize inconvenience of bedwetting episodes. I remember if you ever had a brother or a sister who was bedwetting, and in our time we used to share a bed, it used to be a lot of struggle and very uncomfortable at some point. But this is what we introduced. Now we have bedding protection for the adults to do that. Supportive care, emotional support and encouragement from healthcare provider, family members, or supportive groups can be invaluable for individual coping with the adult bedwetting. Open communication with and also understanding, acceptance can reduce the feelings of shame and embarrassment associated with the condition. So the emotional aspect of it, so with the supportive system is very important so that we don't get that people to get ashamed and also embarrassed because sometimes it's very embarrassing for them and adult bedwetting. It's essential to work closely with healthcare provider to develop individualized treatment plan tailored to your specific need and also circumstances. With proper evaluation and treatment, many adults and the bedwetting with the bedwetting experience improve significantly the symptoms and also we improve their quality of life. On the if sometimes when we manage this condition of adult bedwetting or nocturnal enuresis, sometimes uh, we have a way of managing them, and sometimes it may not be out of complications, but we have a few complications of nocturnal enuresis. Number one is about skin irritation, especially when you get like patients who have a stroke and they're not able to move from bed, they're waiting there, so prolonged exposure to urine can irritate the skin, leading to inflammation, redness, itching, and also discomfort. So skin irritation can increase the risk of skin infections such as urinary tract infections and also dermatitis at some point as a skin condition. So it's very important as we prevent those who are exposed to this uh, to urine so that it doesn't cause to irritate the skin and also inflammation and redness, itching and discomfort because when the skin is open now we are predisposed to other problems like dermatitis. Sleep disorders like adult bedwetting can disrupt sleep patterns and lead to fragmented sleep. I know if you ever experienced this, especially as a child, when your bed is wet, you can't sleep very quality. So imagine that in an adult who is experiencing this at particular point. So there's a lot of poor sleep in that kind of a person, and this may contribute to the daytime fatigue, irritability, difficult to concentrate, and also impaired cognitive function. Because of lack of enough sleep, one is likely to have daytime fatigue, irritability, difficulty in concentration, and also impaired cognitive function, which is not very interesting. And also, this bedwetting may impact on relationship. Adult bedwetting can affect interpersonal relationships, causing embarrassment, shame, and social isolation. Also, fear of judgment or ridicule from others may lead to avoidance of social activities. If it is in a partner, intimacy may be a problem, and also further exacerbate feelings of loneliness and also isolation. So, on emotional stress, as also a complication, coping with adult bedwetting can be emotionally distressing and impact self-esteem, confidence, and also the mental health. Feelings of shame and also embarrassment, guilt, or depression may arise, leading to emotional distress and impaired quality of life. Also, as a complication, we have this decreased quality of life. Adult bedwetting significantly diminish overall quality of life, affecting the aspects of daily functioning, including work, social activities, travel, and leisure pursuits. The fear of bedwetting episodes may lead to avoidance of behaviors and also limitation of personal freedom and independence. And also, risk for injuries is also a complication. Wetting can increase the risk of falls uh, uh, or accidents, particularly of individuals who need to get up at night to change beddings or use the bathroom. Sleep exercises, poor visibility is normally they pose additional hazards for that kind of a patient or an individual. Because, like here in Africa, we have our toilets outside the house. Imagine a person working out and is predisposed to injury and other problems. Negative coping strategies. Some individuals may resort to negative coping strategies such as alcohol or substance abuse to cope with the emotional distress and shame associated with the adult bedwetting. This behavior can exacerbate underlying issues and lead to further complications. So some people may hide in alcohol and substance abuse to cover up that one. Also, a very important aspect of this is about impact on work and also social life. Adult bedwetting may interfere with work responsibilities, productivity, and social engagement, leading to absenteeism, reduced participation in social activities, and also limitation on travel or leisure pursuits. So it is important for individual experiencing adult bedwetting to seek help from healthcare professionals for evaluation, diagnosis, and appropriate management. With proper treatment and support, guys, many people can effectively manage bedwetting and improve the overall well-being of the quality of their life. On the prevention part of it, preventing adult bedwetting often involves identifying and addressing the underlying cause, as I mentioned earlier. So, I'm going to give you some measures how we can prevent adult bedwetting. Number one is maintaining good bladder habits. Practice good habits by emptying your bladder regularly during the day and avoiding holding urine for extended period of time. So also avoid excessive fluid intake before bedtime, particularly caffeinated or alcoholic beverages, which increase the urine production and irritate the bladder. So that is one of the way we can prevent this adult bedwetting. Number two is about manage underlying medical conditions. Treat and manage underlying medical conditions that may contribute to adult bedwetting, such as urinary tract infections, diabetes, neurological disorders, or sleep disorders. And four, recommended treatment for as provided by the healthcare provider to control symptoms and reduce the risk of bedwetting. Number three is about address sleep disorders. Seek evaluation and treatment for sleep disorders such as obstructive sleep apnea or OSA or restless leg syndrome, which can disrupt the sleep patterns and contribute to bedwetting. Using continuous positive airway pressure or CPAP therapy for those who have those who have obstructive sleep apnea, there's a way CPAP can be used for OSA and also for patients to improve their quality of sleep and also reduce the nocturnal enuresis. Also, maintain healthy lifestyle by adopting a lifestyle that can support overall bladder health by reducing the risk of bedwetting, maintain a balanced diet, engage in regular physical activity, maintain healthy weight, and practice stress reduction techniques to promote physical and mental well-being. So, practice bladder training also to improve control the reduce of bedwetting by doing those pelvic muscle exercises, which are very important. So and also increasing the time between your visit to the bathroom. That's what you are also trained on, and using relaxation techniques to delay the urination. Number six, about limiting stimulants like caffeine or alcohol and other stimulants, especially in the evening and before bedtime. These substances can increase urine production, irritate the bladder, and disrupt patterns of sleep and also lead to bedwetting. Also, number seven is about managing your stress and also anxiety very well. So, these are emotional factors which can contribute to bedwetting. So, engage in stress reduction techniques such as mindfulness and also meditation, deep breathing exercises, relaxation therapies to promote emotional well-being and reduce the likelihood of bedwetting. That includes also yoga, which is not very common in Africa, but very important to encourage yourself to manage stress and anxiety through deep breathing exercises, relaxation, and also meditation and also mindfulness. Also, very important, seek medical or professional help. If you experience persistent or recurrent adult weddings or bedwetting, seek evaluation and guidance from healthcare professionals, including primary care provider like urologists or a sleep specialists. A thorough evaluation can help identify the causes and develop individualized the treatment plan to address the condition effectively. While it may not always be possible, guys, to prevent bedwetting entirely, that's what I want to tell you. Implementing these preventive measures can reduce the frequency and severity of bedwetting episodes and improve your overall bladder health and also quality of life. So, guys, that is about adult bedwetting or nocturnal enuresis. I don't know if you have experienced it. If you have someone having the challenges, kindly you can have our contact down there. You can tell us what is happening. And also, if you have a nice comment down below, you can make it there. And if you want to communicate with us, our details are on the description of the channel where we can get to share a lot about this topic. So, guys, I want to welcome you to our next video. And kindly, if you have not subscribed, subscribe to Nazvin channel. We are really growing. I want to appreciate what is happening in our channel. It is really growing, and I'm really ensuring that we have at least a video each day for the coming times. So support us, and also I encourage you to share it widely so that we grow the numbers and get to share this kind of knowledge, guys. Thank you very much. Peace, guys, for the next video.